This conference will now be recorded.
Hi, I'm Dr. Steve Pederuti from Intellectual Medicine, speaking to you regarding complementary intravenous treatment to help support your fight against cancer. We'll be discussing vitamin C, alpha-lipoic acid, and mistletoe. By the end of this brief conversation, I hope you'll have a better understanding about how these agents may have value in helping you in your fight against cancer. First, disclosures. None of the treatments I will be discussing have been FDA approved to treat cancer or any other medical disease. They have not been proven to cure cancer, nor to affect its progression. These treatments are based upon basic biological principles, study in laboratory, study in animals, and case controls whereby individuals have experienced the effect of these therapies. Although they've been around for many decades, definitive proof of their benefit remains to be ascertained. The information you'll be getting is up to date and needs to be reflected upon for you to help make your own personal decisions. Drip Bar and I both encourage you to maintain continuity of care with your primary physicians. Treating cancer, what do we want to achieve? Remission, revitalization, and avoiding relapse. In some ways, we all live with cancer every day. It is a cellular disease, and our body is constantly in fight. In some cases, the cancer gains the upper hand and starts to gain a foothold, referred to as tumors in some cases. The majority of cancers are caused by environmental factors. This is actually good news because there are things we can do that affect the environmental consequences of cancer. It's much easier to alter the environment than it is our genetic structure, especially as we will discuss when it comes to the internal environment of our body. Intellectual medicine divides cancers into 3 stages. Active cancer. This is when it's been diagnosed, it's progressing, and action needs to be taken in order to intervene. Whatever stage you're at, this is the period of time where conventional therapy often will offer surgery, radiation therapy, or chemotherapy. Complementary intravenous vitamin C and other modalities can frequently be used concurrent with active treatment. There are studies showing enhanced benefit in such circumstances, as well as a decrease of side effects from chemotherapy, as well as amplification of benefit of radiation therapy. Another phase of cancer is called remission. This is when the cancer is no longer progressing. There may be tumors left, but they do not appear to be actively growing. In many cases, chemotherapy has to be stopped or diminished because of its toxic effects. Complementary treatment, intravenous vitamin C, alpha-lipoic acid, and mistletoe has significant value to afford in this setting because of its safety and the ability to maintain supportive care. Then there's an important arena that is barely addressed through conventional treatments, secondary prevention. This is when you're declared cancer-free. The tumor's gone, no cancer is remaining, CAT scans, MRIs are all negative. It's a happy moment. However, as you'll come to see, cancer can still lurk at a cellular level. Constant activity should be taken to try to help address its risk of relapse. The approach through Drip Bar and functional medicine is to kill the cancer cells, but not to harm the body. In some cases, early on in that active phase I was talking about, chemotherapy, radiation therapy have to be used because of their powerful toxic effects. They do harm the body, but the goal is to kill the cancer cells in disproportionate amounts so that the body can survive the process. Vitamin C, on the other hand, very safe for the body, supportive of cellular health, and toxic to cancer all at the same time. At Drip Bar, the cancer protocols start with intravenous vitamin C. The other elements can be built on top of it so that you can try to arrive at an approach that fits you, fits your life, and fits your need. How does vitamin C work? Well, we all know that vitamin C, given orally, is a powerful antioxidant. It neutralizes free radicals. That's a beautiful thing, except when you want to kill cancer cells. In that environment, we want to be pro-oxidative. You want to use the power of the oxidative process to kill cancer cells. This is where intravenous vitamin C distinguishes itself from oral vitamin C. When taken orally, vitamin C simply cannot achieve the blood levels necessary to be pro-oxidative. Intravenously given, vitamin C can convert to hydrogen peroxide, which is a toxin, kills cancer cells. It's a beautiful thing because your natural cells are protected by the enzyme called catalase. It neutralizes that hydrogen peroxide before it can do any harm to the natural cells. Furthermore, vitamin C has a molecular structure that looks very much like sugar. You know who loves sugar? That's right, cancer cells. So they lap up that vitamin C, hydrogen peroxide pops up. Many have likened this to a Trojan horse approach. Vitamin C goes in and blows up the cancer cells when it turns into hydrogen peroxide. Very exciting concept. Are there side effects? Rarely, and to the extent that they occur, they're quite mild. Some may become thirsty while they're being administered the vitamin C. A bit of lightheadedness may occur. There can be a temporary effect on the kidneys, altering the lab results, but no evidence of permanent damage, and that quickly rebounds. In rare circumstances, muscle tremor may occur. It's uncommon, but should it happen, it's easily treated by administering calcium. The vitamin C infusions take about 60 minutes. Typically, we like to go fast. There is some controversy in the vitamin C world whether slow and long is better or short and fast is better. In intellectual medicine, we advocate for a more rapid infusion to gain higher blood levels, to gain more of a kill impact on the cancer cells. You want to come to your appointment well hydrated. Having a light meal prior, low carbohydrate, is also helpful. Skip your antioxidant supplements that morning. If you're not sure which supplements are or are not antioxidants, we recommend skipping them all. Avoid heavy, intense physical labor for the balance of the day after your infusion, and keep yourself well hydrated to help flush out toxins that may have occurred during your treatment. Clinical impact of vitamin C, well, it's been studied, as I mentioned, for 30 plus years. There have been many individuals that have experienced what we call outlier effects. That's what we're aspiring for with regard to our clients at Drip Bar. An outlier is somebody who's living better and longer than expected. In some cases, going years without any evidence of cancer recurrence. Oftentimes, the studies are done in folks with advanced cancers, stage 4, very aggressive cancers. Some of those studies have shown extended duration and quality of life. Others have demonstrated improved quality of life. Studies combining vitamin C with radiation therapy have by and large shown that vitamin C given intravenously complements the radiation therapy and makes it work better. Phase 1 clinical trials have been done on vitamin C. A phase 1 trial is to support safety and to demonstrate it's safe to use, and those phase 1 trials have had that validation. They're not intended to prove benefit of outcome, but rather a step toward that process. How about alpha-lipoic acid? Another form of intravenous natural substance. Alpha-lipoic acid works by interfering with the cancer cell's ability to make energy. It can disrupt at a mitochondrial level the cancer's ability to reproduce and to thrive. In that way, it attacks cancer through a slightly different pathway than vitamin C. As I mentioned, when you're deciding upon the treatment approach to use, vitamin C is foundational. In every case, we recommend that being the first IV therapy rendered. In some cases, alpha-lipoic acid is given along with vitamin C in sequence. They're both given the same day. What's nice about the alpha-lipoic acid, it helps to interfere with glycolysis, choking off the energy supply of cancer cells, and it helps to prevent harm to the natural cells. It doesn't attack the DNA like chemotherapy can. Side effects, again, are uncommon. Some people can develop stomach pain or nausea. These can be modified by adjusting the dose. I love alpha-lipoic acid, and I love its potential to combine with vitamin C. However, the volume of evidence regarding its benefit is not as robust as vitamin C. Therefore, when deciding between the agents, if you're in a position where it doesn't work for you to do both, I advocate for vitamin C first. Logistics, it takes about 60 minutes to do this infusion. So if you're doing the math, you're doing both alpha-lipoic acid and vitamin C, you can expect to be at the drip bar for a little over 2 hours, because we like to give infusion in between those two for hydration purposes. Again, come well hydrated, light meal prior, done on the same day as intravenous vitamin C. Mistletoe therapy. Viscum is the name applied to the mistletoe that is used currently at drip bar. Mistletoe has been around for many decades, prominent in Germany and Europe, less common in the United States. The mechanism of action appears to be multifactorial. One pathway is through these lectins, which is a toxin produced by the plant, appears to be directly toxic toward cancer cells. It also has an effect of enhancing immune function. The tumor necrosis factor and natural killer cells of your body are stimulated by the viscum in a way that can help it to attack the cancer. So working directly to attack cancer and support immune function. Why do we not advocate intravenous use at drip bar? There are some centers doing intravenous mistletoe. The reason we do not is because the bulk of evidence regarding its benefit comes from the subcutaneous injection route, that's under the skin injection. In addition, the subcutaneous route is enormously cost efficient. It's fractional compared to the IV route. And there are limits to how many different things can be administered intravenously. I already told you, vitamin C is king of the hill when it comes to IV therapy. Next in line, we love alpha-lipoic acid because the viscum can be given subcutaneously, and because the evidence supports its use by that pathway, we can very affordably bring this on board and execute our triple therapy approach that we call it at Intellectual Medicine. Vitamin C, alpha-lipoic acid, and mistletoe. This, folks, is novel. It's something not commonly done, and it's something that we have seen striking effects from thus far at Intellectual Medicine, the triple therapy. Side effects from mistletoe, uncommon. You'll get a red welt at the injection site. That's expected and desired. Fever and headache are rare, and should they occur, they're part of a therapeutic response. So what are the protocols and how do we approach it? Depending on your cancer and your personal circumstances, we have a range of intensity of treatment. Well, why is that? Vitamin C has been shown to be active against many forms of cancer in the laboratory. We have decades of experience with it clinically. However, we do not have absolute feedback and research-based evidence regarding the best frequency or intensity of treatment. So I can't say for sure if doing it twice a week is better than once a week. It would be logical to presume that a more frequent intervention, a more frequent treatment is likely to be better. However, we don't have the evidence in front of us to declare that. Therefore, we have made these ranges of treatment, all of which have potential for benefit, so that you can decide which fits you and your family. It's an important detail. We're talking about treatments that are not FDA approved and yet have enormous potential, in my view, to afford benefit. We don't want anybody to be deprived of the treatment because of a barrier to affordability. My advice is that you aim toward the most intensive treatment that fits your family's budget and lifestyle. We do not want to see you add to your stress of cancer with the oppressive burden of an unmanageable, expensive treatment. On the other hand, we don't want you to feel as if you cannot afford to do twice a week therapy, nothing else is worth considering. By all means, plug this in to part of your cancer treatment in the highest and best way that you can fit it. Then we can make decisions going forward, as you'll see. So your nurse at the drip bar can help guide you through the reflection. I hope this educational video helps you as well. High intensity calls for 2 infusions per week over 12 weeks. After that, after 12 weeks are done, at every step, there's a pause and a reflection. In general, it's the advocacy that you decrease frequency of treatment as long as the cancer is responding favorably and you're feeling well. The goal is to keep the cancer in remission with the least amount of therapy necessary. And by doing this in 12-week cycles, it's long enough to get judgment regarding impact. Now, whatever pathway you start along, you're not committed to finishing that. You can always modify it in midstream. So high intensity, 2 infusions per week for 12 weeks, moderate intensity, weekly infusions for 12 weeks, and modest is every other week for 12 weeks. As I've mentioned, pick the one that best fits your circumstance. If you can afford to do it in time and in cost, go to the high intensity route coming out of the gate. When cancer strikes, you want to hit back hard. However, don't feel backed into a corner. If this exceeds your abilities, then go down to one of the other intensity treatments. The next reflection, should you add alpha-lipoic acid and or mistletoe therapy? Well, we mentioned that vitamin C is foundational. So when I describe these treatment approaches, vitamin C is the core therapy. The others we add to it. Vitamin C is a foundation for cancer support therapy. Now, alpha-lipoic acid is your add-on. When should it be added? In my opinion, if you have a more aggressive form of cancer, put it on board. Hitting cancer from multiple angles is a logical use of complementary care. Alpha-lipoic acid is especially valuable in my view if the cancer has gone to your liver. It's been shown to be regenerative to the liver in other settings. If you've got an aggressive form of cancer that has a poor prognosis, and we really want to hit it hard, then my recommendation is to add the alpha-lipoic acid along with vitamin C. The viscum that is the mistletoe, is easier to add because it's simply so much less expensive. We can teach you how to self-administer this. The subcutaneous route is easy to administer at home. Your nurse at the drip bar can teach you how to do it. In some cases, we can administer it for you as long as you bring the product to us. It can be administered at drip bar at the same time as your intravenous infusion. When it comes to mistletoe therapy, we recommend them at least weekly. The high intensity can be twice a week. Secondary prevention. This is a beautiful place to be because the cancer has been beaten back. But remember, cancer never really disappears. You can be tumor-free. CAT scans and MRIs can be negative, but on a cellular level, the cancer can still be there. The objective is to constantly beat the cancer down, not giving it a chance to breathe. We want to look at the environmental risks, particularly those within your body. Get a provocative heavy metal test at the drip bar. Find out how much cadmium, arsenic, lead is in your body. This can be reduced through intravenous chelation therapy, making some of these carcinogens less prevalent within you. This is an important article that speaks to all forms of cancer, from the New England Journal of Medicine, the 20-year risk of breast cancer recurrence. What they're talking about here is not the traditional 5-year threshold. You know, you make it to 5 years cancer-free, it's considered a cure. But is it really? 5 years is a nice start, but if you're like me, you don't consider that good enough. Now, in this study, they found even stage 1 breast cancer with an extraordinarily high 5-year cure rate had a 10% relapse rate if you went out long enough. So delayed relapse is known to occur with many forms of cancer. Why does this happen? It has to do with something called doubling time. One cell becomes two cells. This can take a month, 2 months, it depends on the cancer. By the time cancer gets to be a centimeter in size, it's had 30 doubling times. That can take years. So cancer can be growing asymptomatic, invisible for years before it reappears. This is one of the reasons why if cancer comes back, it tends to come back in shotgun fashion spread throughout the body. The theory that motivates Drip Bar to encourage people to use intravenous vitamin C once a month on an ongoing basis is that if these cancer cells are growing, the vitamin C has a potential to kill them. It's like weed whacking. Before they can take over the forest, you go back and just cut down the vines. It's inexpensive, it's safe, it's sustainable, and it is a foundational recommendation from Drip Bar to anybody who's ever had cancer. It doesn't give you an early warning sign. The imaging that is done is late in the course of the cancer, even if those tumors are small when they are seen. For a little bit of money and a little bit of hassle time, we have the possibility of tilting the field in your favor. Check heavy metals, get your monthly IV vitamin C, secondary prevention. Conventional treatment will give you conventional outcomes. For many of you, that's not good enough. Adding complementary care, safe possibility of altering the course of your disease. We strongly advocate this for our patients fighting cancer. There's a role for health support. At the Drip Bar, we make it available to you. Well, I hope you found this to be informational as you continue to reflect on how to fight cancer. It's a personal journey and a personal reflection. You can count on Drip Bar to be there with you, helping guide you through this pathway. I encourage you to start the journey today, and I look forward to you being an outlier, to looking cancer in the face and beating it back. Our goal, yours and mine, is to live a long, healthy, and vital life. And if we're destined to be called to the end by virtue of a malignancy, then we want to live vitally until that last moment. The goal of Drip Bar is to have you live your best life. And if that means that the cancer stays in remission indefinitely, that's awesome. That's the goal. If the cancer is to progress, then we want you to feel vital, even in the face of living with it. Well, I'm Dr. Steve Pederuti. I hope this information has been helpful to you. Thank you for visiting the Drip Bar.